Dr. Jibran, welcome to Let the Quran Speak.
Thank you. Good to be here.
Now, last time we talked about how do you talk to your kids about drugs? And now the question is, well, what about if you find out that your child is using drugs? Then what do you do? What's your next step beyond the shock that you might have?
Beyond the shock, and then the first thing beyond the especially with the shock, practice patience. Don't act harshly or in a rash manner in that instance, because that's the time to build that therapeutic relationship. And you know your child better than anybody else. And so begin those conversations and begin to understand what the level of use is. You know, there's a substance use happens on a spectrum. There's even some beneficial use, for example, in the context of some spiritual practices, or like the use of psilocybin or LSD, and then it goes all the way to problematic substance use where it becomes problematic. And so the first thing that you do is assess where they sort of lie on that spectrum.
I guess for a Muslim parent, it would be like anywhere on the spectrum is problematic.
It's probably bad, yeah. And that's where we really need to, relax and not break that therapeutic relationship immediately, and instead work on it, and even use the examples from the life of the Prophet, peace be upon him. And so firstly, you begin forming that therapeutic relationship to understand where their use is at, and obviously there's going to be underreporting from the child towards the parent.
They might be hiding.
They might be hiding, right? Or they might tell you that, oh, this was my first time, I've never done it before, and I promise I'll never do it again.
So what are the signs? Like, how could you tell that it's really serious?
So adolescents are great at hiding things from their parents, right? But for example, with cannabis, there might be some amotivation, or where they're less motivated to do things, or like the munchies that we talked about. Mm-hmm. Or so there are some of those signs. Depending on the drug, those signs will differ.
Okay.
But if you find empty pods around the house or in your garbage that came from a vaping device, that might be a telltale sign as well. So they'll differ depending on what the substance is. But once you've had a chance to establish that, seek help, seek professional help. And so starting with your primary care practitioner, but also you can move towards, counseling and therapy, or even pharmacological help, depending on what the substance is. Yes, while we have a difficult time treating adolescent substance use, a lot of the approaches that work in adults also work in adolescents. And so a professional would be able to help you with that. Mm-hmm. But going back to that point about reacting, I think one other example from the life of the Prophet, peace be upon him, that is really pertinent here is that while Islam did a really good job of prohibition of alcohol, compare that to prohibition of alcohol in the U.S. when the moonshiners and Al Capone and all of that was what happened, and prohibition didn't actually work. Prohibition worked at the time of the Prophet, Prophet peace be upon him, and it worked because of the things that we were talking about earlier. But even though that was the case at the population level, and that was to reduce the potential harms that come with, a whole population using alcohol, at the individual level, the Prophet, peace be upon him, showed compassion to those struggling with it. And so we have at least two different instances of somebody being brought back to the Prophet, peace be upon him, over and over again because of their alcohol drinking to be punished, and then people around them cursing this person. And the Prophet, in both cases, telling them not to curse this person. In one case, saying that, don't help your brother, don't help the devil against your brother. And in another instance, saying that I know for sure that this person loves Allah and loves the Prophet, loves God and loves the Prophet. And so vouching for that person, and also showing compassion and understanding that one of the characteristics of addiction is that it's a chronic relapsing disorder where you try to stay clean, you try to stay off the drug, and then you fall right back in. And that cycle is what is the cycle of addiction, is where you're going from the euphoria to going to then having the withdrawal symptoms, and then the craving, and then you go back right into the substance use.
Do you think there's hope in terms of moving beyond that cycle?
There is, and there is. And especially as Muslims, there's always hope, right? Like, do not despair in the mercy of God. And that's why we don't despair, but understand that that is also a nature of the the problem, and so deal with it accordingly. And the thing that we need is compassion, especially when it comes to your own children. Like unfortunately, sometimes what happens is we take this hardly ourselves, and it's almost a slight against our own egos,
course, yeah.
and then that makes us act out harshly, and there goes any chance of recovery for both you, your child, and your relationship. And so this is where the prophetic example is a beautiful one, and to not just him showing compassion himself, but showing everybody around him that there is a need for compassion there. And so our society, especially the Muslim society, also stigmatizes substance use a lot. And so we should also check ourselves, is our reaction coming from how we actually feel about it, or what are people going to say? And so that's the other angle of it. And so again, look at how the Prophet, peace be upon him, dealt with it, and show that compassion, because that's going to be that first step towards recovery.
Dr. Jibran, can you talk a little bit about mental health? Because do you think parents need to consider the mental health of their children who might be using drugs?
Yeah, so this is something we study in the lab, is the co-occurrence of substance use and mental health. The rates of substance use, regardless of what the specific mental health diagnosis is, from schizophrenia to bipolar disorder to depression, are anywhere between 3 to 10 times higher in these populations compared to the general public.
Wow.
And there are all sorts of hypotheses that have been put out. The self-medication hypothesis is probably the most prevalent one, where the drugs are being used to medicate or to treat some portion of the mental illness. The jury's still out on what the true nature of this chicken or egg question is, but there is a big relationship between the two. And more often than not, substance use actually worsens the course of the disease. So schizophrenia, depression, bipolar, substance use worsens that course. So it is just like we're having conversations with our children about substance use, we should also be mindful of their mental state as well, and have those conversations as well. Just like we were talking about stigmatization of substance use, mental illness is probably even more so stigmatized in the community. And so educate yourselves on the signs for, once again, sleep, for example, is one important and almost a telltale sign when it comes to different mental illnesses. Sleep is disrupted in everything from bipolar disorder to depression to schizophrenia, disrupted in different ways. So in bipolar disorder, a person may not sleep, whereas in depression, they might not be able to get out of bed. And so those are signs that you can look for and help and speak to your children. And once again, start early, speak often. Once you see changes happening, then intervene and continue to be present. And I think that's going to probably be the most important lesson out of all of this, is the need for presence, and for us to be present in the lives of our children and to be noticing changes that might happen and to help them along the path. Because with mental illness, for example, insight is already an issue even in adult patients with mental illness. They have very little insight on their condition. And so as an adolescent who doesn't generally have insight into their existence already, that's even harder. And so we need to provide or help be their mirror in that sense, and then say that I'm noticing a change in your sleep. Are you feeling okay? Are you, or if we see them be anxious, if we see sharp shifts in their mood from being happy to being sad or excessively sad, those are things that we should all be noticing and having conversations about.
Dr. Jibran, thank you for sharing those insights. I really appreciate it.
You're very welcome.